Hello, welcome to the hospital CEO update. Well, this week we continue to have high COVID numbers, which you would anticipate considering the prevalence in the community. Our numbers are in the 120 range this week, and that's higher than it was at this time last year. But hopefully this peak will be brief and we'll be on the downslope as fast as we climbed up. We have to restrict our emergency surgeries again for this week based on New York State Department of Health directive. The entire city, in fact, the entire region is under the same restrictions. So it's a level playing field. It's something that we look at every day, trying to get as many surgeries as possible based on the medical necessity, the time sensitivity, and the availability of staff. We are getting help from the state via the ambulance contract and the paramedics and the EMTs in our emergency department. We've been very fortunate to have a team here from FEMA who has been a tremendous help. They've reduced the offload times of the ambulances and helped out with throughput in the emergency department. The comments from the FEMA team have been outstanding as far as the capabilities of Upstate, and the comments from the Upstate team have been very positive about the capabilities of FEMA, so we're grateful. I have some good news, just heard we're going to get another 2 weeks of FEMA assistance. A new team will be arriving this week to get the handoff from the present team to continue to help us with our needs. So very fortunate to have another FEMA team. We are doing a significant number of tests, both at our Community Suite 1K and at the New York State Fairgrounds. I plead for your patience in getting the results because these teams are doing a really high volume of tests, but we hope that that will be dropping down too as the prevalence drops. So, I make rounds and try to talk to as many people as possible. And this gives hopefully an insight to those of you that don't get a chance to walk around the hospital of how the hospital works and the various important jobs we have in respiratory therapy, in environmental services, and all the other areas that help us, our physical plant people, keep the operation going. So make sure that you understand that this is a team effort, and it's very much appreciated. So I'd like to give a shout out to Dana, who does some miracle work in making sure that we're properly staffed. And as I say goodbye, I want to make sure that you all are kind to one another. This is a tough time and we need to stick together. So talk to you next week.